A new subvariant of the COVID-19 virus is quickly becoming the dominant strain in the U.S. EG5 is a derivative of the Omicron variant. While the new strain is not an immediate public health risk, it does have the ability to evade antibodies created by the COVID-19 vaccine. Here to join us and talk about this is Dr. Joseph Cantor, which I'm sure all of you remember. Thank you so much for joining us.
Oh, thanks, Kara. It's great to be with you.
All right, so let's talk about this new variant. Now, when did the world's health leaders first notice this variation, and was it expected?
Well, we know that COVID-19 mutates. It mutates fairly quickly, and it begets new variants. That's what we've been dealing with the entire pandemic. So the fact that we have a new variant on the horizon or here now is not a surprise at all. EG.5 has been growing for the past few weeks. It's about 20% and growing of all the new cases out there right now, both nationally and here to our best estimate. But I'll tell you this, even though it's growing and will likely grow further and become the dominant variant, we've been down this road many, many times before. We're in a really different place, thankfully, than we were in months and years past of this outbreak. And I don't think this is cause for over-alarm.
Exactly. So let's talk a little bit about the differences between this variant and the last dominant variant, which was Omicron. What makes them different?
You know, they're very similar. This variant is a sublineage of Omicron. It's an Omicron type variant. We've been dealing with Omicron variants for a little while now, so it's not that dissimilar from the variants we've had over the past 6 to 12 months or so. It's all in the same family, and the effects are pretty similar.
All right, so the symptoms would be the same, the cough, the fatigue, things like that, and of course lighter than previous variants of COVID-19.
They are. You know, the thing about COVID is it's a strange virus, and it can cause a whole wide range of symptoms. The ones you mentioned are the classic ones, but we see weird stuff. Remember, loss of taste, loss of smell.
Right.
COVID can do a lot of vague things. This variant is no different than that.
So let's talk a little bit about the vaccine. So this one can possibly evade antibodies created by a COVID-19 vaccine, but is that going to be the case in every person that encounters it?
Not necessarily. You know, what primarily is different now as opposed to, let's say, in the beginning of the pandemic, is this is not a novel virus. It's not new anymore, and we have so many more protections than we had back then. About 95% of this state has either had COVID in the past, been vaccinated, or both. And while that's not 100% protective, it is significant. So we expect that the clinical outcomes, on average, are going to be much less severe than they were at earlier points of this pandemic. Now, I say on average because people who are extremely vulnerable are still vulnerable. I'm talking about people who are older in age, people who have serious medical conditions, particularly immunosuppression. Those people do need to be thinking about what extra precautions might be right for them.
So over the weekend, I did see a few people walking around with masks, and I'm not going to lie, it took me aback. It was shocking to see after not seeing it for so long. Is masking something that we need to be doing regularly now?
The general public, everyone, I don't think so. But there's a lot of room for individualized protections here. And because it's easy to get a high quality mask now, again, that wasn't the case in the beginning of the pandemic, but it's very easy to get a N95 or a KN95, particularly people that either they themselves have serious conditions that put them at risk or live with people that do. They might want to, and we should respect their choice to do so.
All right, so is there anything else people should know about this new variant?
On the horizon, within the next 1 to 2 months, will be a new updated booster that we expect will be a good match for this variant. So I encourage everyone, talk to your trusted healthcare provider now and get a good game plan, not just for that booster, but also for the flu vaccine that will be available soon.
Yes, the flu is around the corner. All right, well, thank you so much for joining us. I appreciate it.
Thank you. My pleasure.